I am Dr. K.V. Sahasranam, Senior Consultant Cardiologist at the Baby Memorial Hospital, Calicut. Today I thought I will discuss with you some of the important aspects of heart diseases, especially what we call as the ischemic heart disease leading on to heart attacks. There are three major diseases which lead to this. One of them is hypertension or high blood pressure. Second is diabetes mellitus. And the third is a high blood cholesterol, which we call as dyslipidemias. Now, if you take the normal population, 1 out of every 4 adults would be having a high blood pressure. But unfortunately, what happens is, half of the patients with blood pressure do not know that they are hypertensive or have high blood pressure. And of those who know that they are having a high blood pressure, half of them are not adequately treated. They do not take medicines to bring down the blood pressure to control levels. So unfortunately, what happens ultimately is that only a small percentage of patients with high blood pressure get properly treated. Hence the importance of diagnosing blood pressure early and also treating them adequately, and the medicines for high blood pressure should be taken continuously every day, day in and day out. Also, the doctor should be visited frequently to know whether the blood pressure is adequately under control. The second disease which is important is diabetes mellitus. Diabetes mellitus also, like high blood pressure, may not be having many symptoms at the onset of the disease. So one has to have a frequent checkup at least after the age of 30 to know that you have a high diabetic value or you have a high blood pressure. These two things have to be checked and found out. Once you are diagnosed diabetic, the doctor will advise you on the diet to follow, and also importantly the exercise which you have to do and the medicines which you have to take. So to get the diabetes well under control, you have to follow a strict regimen. Third important risk factor for heart disease or heart attacks is high blood cholesterol. High blood cholesterol can be hereditary. It can also be acquired by having very careless food habits. Unfortunately, people do not know that it is not the food alone which produces a high cholesterol. 80% of the cholesterol which is in your blood is produced by your own liver, whereas only 20% comes from food, comes from outside, from food like meat, eggs, fish and many others. So the important thing here is to exercise and try to reduce the cholesterol produced in your body, and if the cholesterol is definitely high, medicines should be taken to control this, because just by going on a diet you will not be able to control your cholesterol levels also. High cholesterol levels definitely will lead to heart attacks later on in life. Again, a high cholesterol does not produce any symptoms for the patient, hence the importance of having a blood cholesterol checked after the age of 30 at least. In addition to this, we have to have a regular exercise regimen of about 30 minutes of exercise every day for at least 5 to 6 days a week. Anything like walking, jogging, swimming, cycling, etc. would be the ideal exercise regimens. One does not have to go to the gym or go and do any vigorous exercises to bring down one's high blood pressure, high cholesterol or diabetes mellitus. This is not necessary. Moderate exercise, moderate aerobic exercise is all that is needed for control. Another aspect which I would like to highlight is heart diseases are not uncommon in women, and hence we have to target the women also as far as these lifestyle changes are concerned. Everything should start early in life. You catch them young is the catchword in cardiology. That is, children should be trained to exercise, to go on proper diet. I won't say diet the children, but they should be known how to take a proper diet, and also they should be taught on the importance of all these lifestyle modifications at an early age so that they avoid obesity, they adequately exercise, they take a controlled diet, and when they grow up to be adults, they are also aware of high blood pressure, diabetes and other conditions which can lead to heart attacks. So these are the few things which I wanted to share with you regarding the lifestyle and also the preventive aspects of heart diseases. If you have any doubts or questions, you can add it below this video. I'll be only too happy to answer them. Thank you.